Ovarian cancer is an abnormal growth that happens on the ovaries. We actually, as GYN oncologists, kind of group ovarian cancers into what are called ovarian type cancers. So these can be cancers of the ovary, fallopian tube, or what's called the peritoneum, or the lining of the abdomen. The one thing with ovarian cancers is that they are fairly silent in the symptoms that they present with, which makes them unfortunately fairly difficult to diagnose. So some of the symptoms that women should pay a little bit more attention to are bloating, and all of these symptoms that I'm going to talk about should be persistent over at least a month or two, and symptoms that they experience several times a week. Because a lot of women will get a lot of the symptoms I'm about to discuss just on a regular basis. So significant bloating, a symptom that we call early satiety, which is basically getting full very quickly. Some women will have abdominal or pelvic pain that is unexplained. Also weight loss. If you are losing weight but not intentionally, that can also be a sign of ovarian cancer. So normal screenings for gynecology are extremely important. What I always explain to women coming in who unfortunately have been diagnosed with ovarian cancer, and a lot of them have been having normal screening with their gynecologists and are a little bit confused as to why they've been diagnosed and even diagnosed at later stages, is that realistically there's actually not a very reliable method for screening for ovarian cancer. So while it's very important to go to your gynecologist to receive Pap screening for cervical cancers, there isn't a defined way to screen for ovarian cancers. But when we do our pelvic exams as gynecologists, that's certainly a way where we could detect tumor growth on the ovary or something that you might not have noticed. So it is very important to see your gynecologist on an annual basis for that. I think one misconception is that ovarian cancer is a death sentence. So a lot of women come in, they've heard about ovarian cancer maybe in the past, and that it is an aggressive type of cancer, and that it's, again, that is true generally speaking. But we've made a lot of advancements in treatment for ovarian cancer over the past 5-10 years. That means that patients are doing a lot better on treatment, they're living longer, and have a lot more opportunity for curative treatments. So I think it's important for women to understand that just because they get this diagnosis, doesn't mean that that's the end. There are so many possibilities now.